We all know how important nutrition is to ourselves and to our kids, but in the autism world, our kids tend to be picky eaters. Some of them have chronic constipation and GI issues, and the thought of trying a diet or sticking to a specific diet is overwhelming. Today's guest, Julie Matthews, is a certified nutrition consultant. She has a master's degree in medical nutrition, and she's co-authored a few research papers on nutrition for children with autism. She also has a brand new book out called The Personalized Autism Nutrition Plan. So today we are talking all about nutrition, autism, what to do with picky eaters, how to get rid of junk in our diets, both for our kids and ourselves. It's a great episode. Hope you love it as much as I do. Let's get to this important episode with Julie Matthews. Okay, Julie, it is so great to meet you and to have you on the show. Thank you for joining us today.
Thanks, Mary. I'm glad to be here.
Yeah, so I didn't know anything about you until recently, but I know you have a brand new book coming out in March, and it's on autism and nutrition. And you have an older book also on the same topic, and you seem like a wealth of information. So this is an important topic for many families, autism and nutrition. So first, let's figure out how you landed in the world of nutrition and autism. What's your background? And just quickly catch me and my listeners up on how you found your way to the autism world specifically.
Absolutely. Many years ago, I studied nutrition and it, I started learning about how nutrition can affect behavior and ADHD, and started really looking at writing. My first year paper was all about ADHD. And from there, I met a man who recovered his kids from autism. His name was Michael Lang. And he got me very interested in the world of autism. That there were a lot of things that you can do, that there weren't many people doing it, that there was a lot of physical, digestive pain and discomfort, and that these kids really needed help. And so I jumped right in. I was very passionate from the moment I discovered all of this. And that pretty much was the beginning of my journey. And I've been doing it ever since. So that was many years ago. So for about 22 years, I've been working with kids. I got my master's degree in medical nutrition from Arizona State University. And yeah, that's just really been my passion all along. So I do research and I see clients, and I write books.
Right. So if you've been in the autism world for as long as I have, which is over 25 years, you probably have heard of the gluten casein-free diet and the specific carbohydrate diet, the ketogenic diet. Um, and this isn't just for kids with autism. You mentioned ADHD, even adults, children with and without autism. Our nutrition over the decades has slid into a very bad ditch. But specifically, do you talk in your work about these specific diets, or can you back us up into a bigger view and just talk about autism and nutrition and what's the problem?
Absolutely. So there were a lot of pieces to that. There was autism and nutrition. There was ADHD, anxiety. It's funny. I'm going to show my book because it literally just came in the mail as I was getting ready for this call. And the reason I'm bringing it up, I don't know if it's a little fuzzy maybe, but it's the personalized autism nutrition plan. But the reason I wanted to show it, because it's nourishing hope for kids with ASD, ADHD, anxiety, and neurodevelopmental delays. So in other words, it's not just for autism. And the reason I wanted to bring that up is because there are similar underlying factors that are contributors to a variety of neurodevelopmental delays. And conditions, just neurological conditions and things like anxiety, for example. So when we understand that these conditions have certain underlying factors that we can use nutrition and diet to help address, support, reduce symptoms, improve, all of that, these strategies can be used for multiple things. So if we take a step back on what are some of those underlying conditions, and again, everybody's different, so there might be 8 buckets, but different people are going to have, just like all of us, maybe different challenges with different areas. So digestive capacity, digestive health, that's a big one. So diarrhea, constipation, gas, bloating, pain, abdominal pain, those kinds of things. The microbiome is very often imbalanced. And I'll talk mainly autism for this conversation, but know that all of these underlying factors I'm going to talk about can be factors for these other conditions as well. So also just the health of the immune system, the mitochondria, all of these, our inflammatory response, our ability to handle oxidative stress, our ability to detoxify, all of these things affect how we tolerate foods, which foods we may not tolerate, and which nutrients we might need in greater capacities than other people. And I'm really simplifying it down. We could go into genes and gene SNPs and all sorts of things that are more common in autism or some of these conditions. But that's kind of the underlying reason that diet and nutrition is helpful.
Yeah. And just to comment, because my book and my works and my online course, especially my toddler preschooler course, 50% of the people that join, the parents that join it, introduce themselves in our group, they say they don't have a diagnosis yet. And these techniques that take the behavioral and techniques I use, the nutrition strategies you talk about, they really, you don't have to wait for an autism diagnosis, and it doesn't have to be autism. And a lot of kids that their parents and professionals come to me. They're extremely picky eaters. They have constipation a lot of times, which affects toilet training, sleep, all of the other functions. It affects behavior for sure.
Yeah.
So, and it is so confusing, the information. That's why I'm excited about your new book. So where do families go? Okay, you have a 2 or 3-year-old, signs of autism, maybe a diagnosis, picky eater, constipation, behavior issues. I know where I tell people to start, which is the Becca, the digital assessment, 10 minutes. It's still for free. At marybarbera.com/assessment. We can link that in the show notes. Where we do have parents assess picky eating, bottle use, pacifier use after the age of 1, constipation and special diets. So it is, and then it also looks at behavior and language. So that might be a good tool for people that follow you too, Julie. But in terms of nutrition, where do you dive in for giving people like an assessment to get started with figuring out what they need?
So I have a 12-step approach. And so it starts with what I consider the simplest, lowest hanging fruits that can provide some really good benefit without having to jump into anything too complicated, without needing to know what's underlying it, or start some diet that might be a little bit more advanced or challenging than something else. And that's just step 1 is getting out the junk. So the junk food, the toxins, so the artificial additives, ingredients. Just the other day, literally the other day, the FDA has banned red dye number 3. And, over the years, we've seen them ban one and then another. And fortunately, they're slowly starting to do that. And that's because it can create a whole host of challenges in us. And one of the challenges, just in general, of things like artificial dyes is that they are, and artificial preservatives and additives and things, is they are known to create hyperactivity in children. And this is long known. There's studies in the Lancet from almost 20 years ago. And you talk to parents for 50 years ago, that will tell you that some of them see these types of things. So getting out the artificial additives and preservatives and all of that can go a really long way, can have a dramatic effect on behavior. So again, no matter what their condition is, in fact, the study I'm mentioning was in neurotypical kids who had less hyperactivity. So for other kids, it can be just as profound, if not more profound. No diagnosis is required. So that's just step one. And then from there, people can look at, in my book, I talk a lot about symptoms, what symptoms may be more associated with certain foods or food compounds, and might give people clues on where to start. So they can look at, here's a list of the common foods that like, let's say, salicylates. Here's a list of the common foods that have salicylates, and here's a list of the common symptoms from salicylates. And that can be a helpful way for parents to guide the direction that they might want to go, or get some clues as to what they might want to dive into further and learn more about.
And do you recommend that the whole family follow these steps, the siblings, how does that work?
Generally, yes. So for example, if we want to have a healthier diet and we want to get rid of the junk, if some kids are eating the brightly colored breakfast cereal and then the other child isn't allowed to, that's really tough. It's not really fair for the one child. It makes it hard to get them to be compliant with the diet. So, and it's going to be healthier for everybody if everybody gives up those foods. So that's just a small example. But also, since there's a lot of this that has to do with how somebody reacts based on their genetic predisposition or even their environment. Like if people in a household will often have very similar gut bacteria. So even it doesn't have to be like those exact same genes, but when you live in the same house, also those can be factors. So when one person benefits, it's very possible another one will. One of the families that did my program that's in the book, they had a son with autism, a daughter with different challenges, a husband and a wife, and they all got but benefits in different ways. Like the sibling had more benefits with anxiety and things that they were struggling with. So I have found many times, I've had more than one mother lose over 50 pounds doing the diet that they chose for the child because they were having a problem, but their challenge with that food was a problem related to a different mechanism than it was for the child, but they apparently had some similar underlying thing that made them not tolerate that food. It just manifested differently.
So what do you say to families? I have a whole chapter in my book on solving picky eating. But what do you say to families that are like, the only thing my child eats is, I've had a client who all he ate was gluten-free crackers and almond milk from a bottle. And I've heard of kids that will only eat double stuffed Oreos, McDonald's fries, and, water. And so getting out the junk, and I believe kids like that really need behavioral feeding programs, positive behavioral feeding programs to really get, and nutrition consultation to get, because these kids, and I did an interview, we can link in the show notes, with Dr. Keith Williams, who is a doctoral level behavior analyst and an international feeding expert. And he said, even a couple of years ago when I interviewed him, he is seeing scabies and rickets and all kinds of weird, intense nutrition issues in some kids who have like these really restrictive diets. So do you say that if people are like, if I got rid of the junk, we would have nothing to eat? You know, where do they go?
Good question. Good question. Yes, there is good research. Things like uh, scurvy, all sorts of things. When you only
Oh
eat.
yeah, I meant scurvy, not
Yes,
scabies.
I know, I
I'm
know, I
sorry.
know, I
I'm
know.
sorry. That was my bad. Yeah, so kids are getting scurvy
Yeah.
and rickets, and those are
Yes,
vitamin deficiencies. Yeah.
absolutely. Yes, I know what you were talking about.
Yeah,
Uh,
but I don't want to say scabies is like
got it, got it. And which is a vitamin C and a vitamin D deficiency.
yeah.
And yes, that's possible. I don't, I prefer to focus on what people can do or, that kind of thing rather than the, uh, what can happen. But the truth is, it is important because some people think, well, as long as I get them to eat. And obviously, when you're struggling, just getting them to eat is important. But realizing that they can get deficiencies and sometimes pretty significant deficiencies if their diet isn't healthy. And I also have an entire chapter because if you work with kids with autism, you know that it is important to work with picky eating because it is so common. So about 80% of kids with developmental delays in general have picky eating. And they did a study on kids with autism, and they found with kids with autism, they could identify that child based on their eating habits because they're the only group of developmental delays that had very specific eating habits and as many as they had. And so it's something that is important to address. So I'm glad you're bringing it up. Yeah.
Yeah, in fact, it's in my chapter too on picky eating. A 2019 study done showed that picky eating was actually a diagnostic indicator for autism. So if you have a 2-year-old that's not talking and showing some signs of autism and is a great eater versus a 2-year-old showing some signs of autism and is a very restrictive picky eater, the picky eater is much more likely to get a diagnosis.
Yes. So I think the first thing I would say is you're not alone. If that's your experience, I know it can be challenging, but you are not alone and it's not uncommon. And there are things that you can do. So there's everything like the guest you mentioned that you had on, variety of feeding experts that can help. But there's also things like nutrient deficiencies can contribute. Food intolerances, inability to break down certain foods properly can cause uh, basically like an addiction. So if you can't break down gluten, which is found in wheat, and dairy, then you can create these opioid compounds that can get into your bloodstream, can get into your brain. And we all know that opiates, like morphine and things like that, they are very, very addictive. And we know that kids with autism have higher level of these opiates that get created from these foods. And so sometimes their diet is very, very limited. So sometimes addressing diet can be incredibly helpful. Sometimes addressing nutrient deficiencies can be. Sometimes looking at the texture of the food and being creative around the texture. So I try to work a lot and provide recipes that are going to be crispy and crunchy vegetables and other things that they enjoy more. So those are just, I think, some of the ways that I go about looking at that picky eating topic.
Yeah. So you don't recommend right away jumping into a specific diet, or you have steps that eventually might lead you that way, right?
Yes. So I like to do things in steps because if you go all the way to the most restrictive diet, uh, then you're not going to know, was it just one thing that you could have done, or was it this principle or this principle? So yes, I do have a step-by-step approach to help parents figure out uh, what symptoms they have, what have they tried, that kind of thing. I mean, and so I'd like to start with get the junk out, get good healthy things in, get good healthy foods, get some good healthy basic nutrients in, work and support the picky eating in whatever way you can start to figure out texture, and then start looking at special diets and things like a gluten-free and dairy-free diet. And then as you mentioned, I work with over over a dozen different diets. And so my book does talk about all of them and, when someone might consider one diet versus another diet and things you can look at, maybe tests you can do or symptoms or, different ways to get clues as to which way might be a good way to go. But there are simple things that people can do or diets that are good starting points for most people.
Yeah. And maybe some of it is, I know I have like an easy, medium, difficult food list that I talk about. And maybe your child will eat cookies and corn chips, and they might eat cereal like Cheerios or something like that. And it's like they're all junk. They all have stuff in them that isn't great. But the Cheerios at least has some vitamins in it. And I used to be a big proponent of like weaning off juice. But then after I talked to Dr. Williams, he's like, juice isn't all bad, but maybe make it, without any of the junk in the juice, and maybe making it weaker, just because if he looks at a child that's drinking juice, or like apple juice or orange juice, he knows that they probably don't have a vitamin C deficiency and those sorts of things. So maybe for some of these families with picky eaters that aren't extreme enough to see somebody immediately, but maybe you could make it less junky.
That's a good start. Step number one, make it less junky.
Make
That's
it less
yeah.
junky. um
Yes. I mean, I do agree with you. I mean, I do try to add things before removing things. So while I think there might be better choices to things like juice, or better ways, like you said, like water it down or freshly squeezed juice or like literally home pressed juice, or there it all depends on the child. If they're dealing with a lot of microbiome disruption, like bacteria and yeast, and they might need a different approach than somebody else. But if they're only eating three things, I wouldn't say remove the three things. Typically I would try to add more things to, generally speaking. And of course, there's always nuance too. Depends what those things are and what's going on for them. But yeah, I mean, I like to do step by step, easy. I'm not saying that it's always easy, but try to make it easier on them.
Yeah, yeah. So I know you co-authored, in addition to your two books, you have your new book, The Personalized Autism Nutrition Plan, and then you have a 2008 book. And what's the title of your older book?
Nourishing Hope for Autism.
Nursing Hope for Autism. But you're also the co-author of a couple of research studies demonstrating the efficacy of nutrition and diet intervention for kids with autism. So can you tell us real briefly about those studies?
Yes, I'd be happy to. So our first study, Dr. James Adams is the lead researcher, and I had the fortunate opportunity to help him with these studies. This particular study was looking at a randomized controlled trial. So a experiment looking at kids that with autism that did a diet and nutrition approach versus those that didn't. And we looked at actually 6 different things: a healthy, gluten-free, casein-free, and soy-free diet, and then a variety of carnitine, Epsom salt baths, multivitamin mineral formula, essential fatty acids, things like that. So we looked at this comprehensive digestive enzymes. So we looked at this comprehensive approach over the course of a year and found really great results. 4.5 times the developmental age improvement, almost 7 points in nonverbal IQ.
Wow. How many
Yeah.
kids were in that study?
Oh, I want to say 70, but I don't remember off the top of my head.
Is that something, that paper, could we include that in the show notes?
Absolutely.
Okay,
Absolutely.
okay. So that'll be in the show notes. Hopefully this is episode 310. So marybarbera.com/310. Because I know we have a lot of parents, but we also have a lot of professionals that,
Yes.
if you have research, then we'll take a look for sure. Okay, so tell me about your second study.
Yep. Yeah, and just for people, it's the first one is called a comprehensive nutritional and dietary intervention for
Okay.
autism spectrum disorder. And the nice thing about it was that it looks at a nutritional intervention the way that we actually do it in reality. You know, you don't just give vitamin C and wait a year and see what happens. No, you want to do everything you can and do the things that are most effective. And so it really mimics more of a real life scenario. So I think that's nice as
Well,
well.
I think it, and you make a good point, Julie, because it's so hard to research nutrition and diet.
Yes.
Because it's all day long, it can't really be double blinded. You know, you can't, you know what you're eating. And it's a lot if you, even if you track food, and it's just a lot of work. It's a lot of you know, effort for families to enroll in a study, to stay with a study, to track, to report in, to get blood testing. And so, you know, a lot of people over the years, 25 years, I mean, we did try gluten casein-free diet for my son Lucas, but he was extremely picky. And my husband's like, you know, this is like 1999. He's like, we're not trying a gluten casein-free diet until he eats like more than four things. So we did take him to a feeding clinic and that sort of thing. And then we tried the gluten casein-free diet. So, you know, I think a lot of professionals, especially behavioral professionals, are just like, that's junk science. And as a doctoral level behavior analyst and a registered nurse and a mom and an advocate, I don't think it's all junk science. I think it's hard, obviously, or I wouldn't have asked you to be on the show. Like, I believe that nutrition and autism, that it's super important that we start to get this right. And I don't think a lot of people get it right. And so I want to highlight these studies. So tell us about your second study.
Yes, and I'm so glad because research is one of my favorite things. So I'm so glad. The second study was on 13 different therapeutic diets, looking at uh, around 800 people that filled out their experience in a survey of how diet works for them. And the great thing I think about this is this survey also looked at supplements, like nutritional supplements, as well as uh, medications, particularly psychiatric and seizure medications, and compared them as well as the individual diet. So if you took overall diet was statistically significantly better than both of those others at creating an overall benefit, providing an overall benefit, and was significantly lower adverse risks than the psychiatric and seizure medication. So there were lots of upside to doing the diet interventions. Then we looked at each diet intervention individually. There were 13 different diets, and we looked at 24 different symptom improvements. And so we were able to see which diet helped most with this symptom and which diet, was best overall. And so there were, I think, about 700 data points that we calculated and put as many as we could into the paper. Just really, it was just so rich in information. And so we looked at a gluten-free, casein-free diet, a gluten-free diet separately, a casein-free diet separately, a soy-free diet, a corn-free diet, a specific carbohydrate diet, a paleo diet, a food avoidance diet based on observation, and then a food avoidance diet based on IgE and IgG testing. So food allergy and food sensitivity testing, a ketogenic diet. So those are the ones off the top of my head that I can remember.
Yeah. Well, hopefully we can link both of those in the show notes. I think
Yes.
that will be awesome. I know I am interested in reading that. So how can people find you, your new book, and your work?
Yes. So they can go to nourishinghope.com to find more about me and my work. They can go to the website for my new book, which is personalized autism nutrition plan.com. And also, if they go there, they can go over to even /pre-order. And there's all sorts of fun extra colored handouts and guides and things I can put on the refrigerator and things like that if they are interested in the book. I think those are the two primary ways to find me.
Okay, we'll link this all in the show notes. And before I let you go, part of my podcast goals are not to just help the kids, but help the parents and professionals listening. Do you have any stress tips or self-care activities that you recommend that we all should be doing?
That's interesting. I just talked about this to my parents in my, group program online, just the very last call that we had. So yes, I think one is to figure out how much time you can put aside. And even if it's 2 minutes, there are things that you can do in 2 minutes. So don't feel like you need a lot of time to do it. If you have 2 minutes, personally, I like something called tapping. I feel like that can be a nice stress reliever. There's great apps for that. I like just take a few breaths. Hey, if you can take a walk, you can call a friend. To me, those are just some of the really simple things. If you have more time and capacity, get a massage or a cranial sacral session or whatever that modality, acupuncture, whatever that modality is that you enjoy the most. So again, it depends what you have in your day, but hopefully we can all find 2 minutes to do a little bit of something. It really can make a big difference in our day.
Yeah, well, thank you. Thank you so much for joining us. I think the show notes will be full of a lot of good information for people that want to dive in. I know I'm interested in reading more about your work, and your new book sounds really exciting too. So congratulations and thanks again.
Thank you, Mary. Thanks so much.